Police in Lexington say they're responding to a lot more calls involving domestic violence and mental health. According to crime data, 8 homicide victims this year died at the hands of someone they knew well. Evening Edition's Christiana Ford takes a closer look at what's happening in Lexington and if anything can be done to change it.
The city of Lexington set a new homicide record in the month of May. And according to Lexington Police Department's crime data, at least 36% of the victims were due to domestic violence.
I gotta tell you, I haven't seen some of the domestic stuff that we've seen.
And because of it, local officials are paying extra attention to the connection between mental health and crime. Police say lately they're seeing a lot more mental health related calls for service.
New Vista Helpline, this is Jim.
And so have the community's mental health experts at New Vista. New Vista has a 24-hour, 7-day-a-week helpline for people in crisis or just in need. In January, they took 6,681 calls. In February, 6,369 calls. But in May, they answered even more. In the last 9 months, New Vista's mobile crisis team has consulted or responded to the scene for Lexington Police at least 30 times.
The police will call our crisis team and ask for assistance. Sometimes our crisis team will get in touch with police.
So far this year, the mobile team is averaging 110 total requests a month.
I think it would be foolish to think that the pandemic hasn't affected people.
Proving how critical mental health professionals and resources are in the city right now.
And I feel really strongly that New Vista is working really hard to be that safety net at this time.
Community leaders believe that if people use the resources available, we could cut into the increase in mental health crises.
Why aren't people getting the help that they need when the resources are there in the community, like people like you?
I think sometimes people just aren't aware of all the resources that are out there.
Fayette County District Court judges Melissa Moore Murphy and Lindsay Thurston are seeing the effects of missed opportunities to address mental health through cases in their courtrooms.
It's very often we see both. We see a crime that's been committed and we see a mental health concern in the same person.
Leading into the pandemic, 30.4% of adults with serious mental illness did not receive mental health treatment. To put that in perspective, 30% represents 61,000 adults in Kentucky. That's why they are working to connect people accused of crime to resources while also holding them accountable.
Sometimes somebody needs that hand holding. Let's walk you over to a New Vista. Let's take you over to this place to work on this mental health assessment. And I think that we need to be aware that sometimes it takes that.
So what happens next? Mental health agencies get more money and more resources to let people know they exist. Will we see more changes with crime and mental health? The answer is complex.
We need to also realize we're not going to prevent absolutely everything every time.
Less than 10% of shootings nationwide involve a suspect who has a mental illness.
It's always going to be there, but if we get the right people together, if we work hard at it, if we get the resources and make sure those resources are known to people.
They're hoping the negative trend they're seeing now will eventually go back down. Christiana Ford, Evening Edition.